I'm going to be talking today about something that I think is a fairly remarkable new set of guidelines for authorship. And I want to talk about authorship both because they're guidelines, but also because authorship is without question the single most contentious ethical issue in biomedical research collaborations. And when I talk about authorship, I typically talk to multidisciplinary groups, and everybody in the room has a story of a different way that some other group, some other discipline did things and how they encountered conflicting standards. And I think this is truly, especially within the CTSAs, as we're trying to be both interdisciplinary and interinstitutional, an area where having upfront discussion can be very, very important. I also like to ask how many people in the room have been published authors. So everybody in the room, we have some students I know. Any of you an author on a paper with authors you don't think belonged there? Any of you think you should be on a paper that you're not on? Usually there's a pretty good number that answer yes to both of those other questions, which reflects the fact that there is variation in the standards of practice, maybe not the ethical standards, but the standards of practice in how we think about research results being written up. And I'm going to be walking back and forth a little bit because it's dark back here in the corner, and the slide advancer went home with somebody recently. Many of you may recognize this list as the recommended core areas for RCR education from the NIH's policy statement on responsible conduct of research education for trainees with NIH funding. So K awards, F awards, T32 awards, all are required to have some form of instruction in the responsible conduct of research as part of the training in the science itself. And when this list was put together in 2009, it was based originally, or based on an original listing put together by the Office of Research Integrity in 2000. In 2000, ORI identified what they called the 9 core instructional areas of responsible conduct of research, based on a kind of consensus about areas where people needed to know how to do things well, or their practice could inadvertently damage the research record. And not just result in bad data being published, but potentially have downstream harms for people who might use the data for clinical work, or worse, from many people's perspectives, it might damage the integrity of science so that the public wouldn't trust research, and so that researchers couldn't trust each other's work. Responsible authorship and publication was one of the top issues, and it is interesting that many of these areas since 2000 have generated lots and lots of federal regulatory oversight structures, federal standards of practice, federal statements that we all have to sign now, conflict of interest, data sharing agreements, things that there are federal guidances on. But for the most part, authorship and publication have been left as issues for professional standards, professional oversight, professional sense of what is the ethical norm or the ethical ideal that we're shooting for and how to get there in practicality. There are 3 different sets of documents that I'd like to call your attention to. I'm mostly going to talk about the first one with some comments about the second one, which they refer to each other. The International Committee of Medical Journal Editors is a group that started in the 1970s largely as an effort at recognizing that many people among the editors were seeing papers resubmitted that had been rejected by one article. They would shop it the way we all still do. You get rejected by one, you send it to the next. I'm looking, this is a relatively young audience, but a couple of you will remember typing your manuscripts. And typing a manuscript made an awful lot of investment in the reference section when the journal you were submitting to had a different reference section from a different reference format from the journal that had just rejected you. So the medical journal editors got together in Vancouver in 1978 and created what has since been called the Vancouver style, in which they created a standard reference format and a standard manuscript presentation format, and the ICMJE uniform requirements for manuscripts submitted to biomedical journals until August of 2013 was a document that grew out of the need to have standards of format into addressing standards of all kinds of ethical issues. And all kinds of ethical issues that for the most part are things that we now also have regulatory oversight for, but which vary from country to country. COPE, the Committee on Publication Ethics, is a group that's housed in London, but they are an international group of editors interested in the ethics of publication. They have a number of formal policy documents and standards, and they run a really interesting service for their members, which is there's a combination helpline complaint desk where if you're an editor with a problem, you can present the problem to your peers, they will discuss it in an online forum, and then when the discussion is over, they will post the conclusions of the discussion. And so it's great for teaching. It's also great if you're looking to find out the norm on any particular kind of problem. The World Association of Medical Editors has an editorial policy committee that has also published a number of policy statements, and they have a variety of things that are mostly European-based, but can be extrapolated to some US practices. And obviously, if you're in an international collaboration, you may want to have what they call WWAMI, the WWAMI's oversight structures apply to the work that you're doing. So these are three authoritative statements, and no need to embarrass yourself if you don't want to answer completely honestly. Had you heard of any of these? Everybody, I hope, has heard of the International Committee of Medical Journal Editors guidelines. Many people whom I talk to say, well, really there are no standards for publication. There are no standards for ethical authorship. It really is just what the field requires. And in reality, this is an area that has been so contentious that journal editors have worked very hard to try and articulate standards. It's those of us on the other side of the publication process who are often not aware of it. When we want to think about how important these standards are, there are over 1,800 worldwide indexed publications that follow and have signed a document saying they agree that they will adhere to and promote the International Committee Standards on Ethics, or Standards on Manuscripts, including some that I think everybody in the room would be really proud to publish in. So Academic Medicine, American Journal of Epidemiology, American Journal of Public Health, JAMA and all of its affiliated journals, Lancet, New England Journal of Medicine, Pediatrics, places that do a lot of really strong clinical research want their researchers, want their writers, their authors, to follow the guidelines in the International Committee's statement. Now, I said that in 2013, the uniform requirements were modified, and they were modified after about 4 years of being in place. 2009, the committee came up with another set of revisions where they looked at another set of questions involving yet another set of regulatory guidelines that had been issued in the United States on conflicts of interest and questions that were not yet regulated on large data and how big data research ethics was going to affect publication. But they revised what had been the uniform requirements to be now recommendations for the conduct, reporting, editing, and publication of scholarly work. And although much of the material is the same between the 2010 edition and the August 2013, now recently revised in December of 2013, the material has been reorganized to address things in a slightly more seamless way. It's not quite the bullet points that it was before. I'm going to talk about, and I'm not sure from the back of the room if you can distinguish that the top is a little more yellow than the bottom. I'm going to talk mostly about the first bullet point and the second big bullet point with the first two sub-questions, corrections and version control, scientific misconduct, expressions of concern and retraction, along with the roles and responsibilities of all the parties that take part in publication. I want to point out, though, a couple of the policies that are relevant that I'm going to be referring to just by calling them COPE. The Code of Conduct and Best Practice Guidelines for Journal Editors. They take this very seriously, that journal editorship is a moral obligation. To be a journal editor means you have a professional commitment to good practices. They have also guidelines on text recycling, which is what they refer to as the reuse of the same materials, sometimes acceptable, sometimes not. If you're using the same methods in 6 papers, maybe a repetition of the method section is not inappropriate. But they don't want to call it self-plagiarism, they don't want to call it other things, they call it recycling. They have a fairly good article that I recommend to my junior people, how to handle authorship disputes. And the answer is you don't let them become a dispute, you deal with it up front. And so it really isn't about disputes, that's a marketing title. WAMI also has some policy statements on authorship and peer review. I'm not going to talk about them as much because they are somewhat repetitious and a little shorter. They also address the question of responding to allegations of possible misconduct, which I am going to refer to. But again, WAMI.org and publicationethics.org are the site of those two reference sets. So when we think about what the responsibilities of authors and editors and publishers are, when we think about why there are ethical standards in publication at all, it's based largely in what the goals of publication are. And I think we can identify 2 areas of goals. One is the academic goal and the other is the economic goal. And they are very definitely overlapping. The academic goal, or we might even say the scientific goal, is to communicate research findings, to get information out. And to get information out in ways that other people can then begin to build on it. Because no one's work starts from scratch without having been influenced or informed by somebody else's research. And at the same time, we don't want to duplicate things that have already been done. Especially if in that duplication we may spend resources and intellectual capital that we could be spending on other things. Getting your information out is also essential to the scientific method because it helps you counter a lack of objectivity about your own work. What you see as a great paper, somebody else is almost always going to find problems with. And that shouldn't make you feel bad. That should make you feel good that they took the time to read it. That's a take-home message from this talk. They took the time to read it and to ask questions about it. That kind of peer review and critique is really important for the validation of the findings and the pushing of the authors to question their own data and then ideally to move to the next question, the next scientific question that they may have about their work. And the stimulation of new questions from reading something, from seeing a paper, how else would you know what someone was doing on the other side of the world if you didn't read about what it was that they had published, even in a news flash about what they'd published, and then go and find the article? It stimulates new ideas, it builds collaborative networks, and along with that, as I said a minute ago about the idea that there's a news flash, science becomes newsworthy to the public, especially on Tuesday afternoon, the news stories from what the the Wall Street Journal and the New York Times have science sections. On Wednesday we get the broader newspapers are publishing, all of which is dependent on the Wednesday and Thursday publication of the major medical journals. And they do that in a way that times release of important scientific information. I think usually it's to kind of catch the slow news week. or slow spot in the week's news. But public acceptance and understanding of science is important for the key thing that everybody is looking for, which is funding to continue doing the work. So increasing public awareness of science is an important academic piece. Economically, when you publish, you're establishing property rights over the intellectual content of the article. You haven't published it, how do you know it's yours? You haven't published it, how can you claim to have been there first? So that authorship establishes not just copyright, because you sign that away to the journal, but it establishes that you did the work in a way that allows you to claim it as your own. And clearly, we are, as institutions, interested in advancing research out of our own institutions, because that helps the institution continue to have a high reputation. It often results in translatable research that can then be turned into a product and funded and licensed and funded, and income streams for the university, perhaps for the investigator. It is very important when you get a $250,000 grant to be able to go back to NIH and say, see, I really did something with it, I didn't spend it in the Bahamas, or my research was in the Bahamas, but I really did do something that generated meaningful data. And so documenting the productivity with the funds is an important economic consequence of publication. And then, as I said a minute ago about public trust, you are increasing public support for taxpayers' dollars being used to fund research, which I am not going to lobby because I'm on an NIH grant, I'm not allowed to lobby, but is a really big issue for academic medical centers when Congress decides they don't want to fund research, or maybe some kinds of research and not other kinds of research. Something we don't talk much about, and there's probably not time in this venue to discuss, how many of you made money off of your last publication? Nobody. You made, okay, maybe one person made a little money off of her last publication. Somebody made money off those publications, though. It's a hugely lucrative business. And when we think about the publication industry, both in terms of the growth of journals and the growth of journals and the growth of the research enterprise in general that is putting new data into things every day. We have a huge system that is not unregulated, but that is largely overseen by professional standards of ethics and not by either sort of market forces, although they're at work, or regulatory structures. So in just an overview, there are over 2,000 scientific publishers that publish in English in the United States and in the ambit in which we work. There are over 16,000, and I'm going to put air quotes around real, journals. 5,600 of them indexed in PubMed. And when was the last time anybody checked their email and found the announcement of a new journal, wouldn't you please like to publish in? Journal that I've never heard of that is got an international group of research advisors, again, from places you don't know. Lots and lots of new online journals coming. And coming in part because there are researchers who need to publish in order to be promoted. And this is particularly true in the developing world where people are challenged to publish in English. Again, that's a slightly different conversation than the one today. But there is actual competition among journals for good papers. We don't think about it for the most part because we know the journals that we want to publish in. But if you talk to journal editors, they say, you know, I should have gotten that paper. I wish I'd had so-and-so's paper. And some really high-level people will actually kind of bid journal editors off of each other by calling and saying, I have this paper that I'm working on, I'm almost finished, would you be interested? To get it into a higher profile publication. So it is a competitive world. And it's a competitive world in a way that creates some ethical tension. Because not everything that gets published maybe should be published. And what qualifies for publication changes depending on the discipline and depending in many respects on the journals that you're looking at. In the ethical standards, what it takes to be a publication is an original, authentic, relevant, and complete piece of scholarship, which means either a really long paper in some disciplines or a very small question. Because the alternative is to chop a big study up into lots of pieces, or to take little pieces and find something you can fluff them up with. In the vernacular in research integrity, we talk about the least publishable unit and salami slicing of data. How thin can you slice it? What is the smallest thing you can publish? And then there's the hamburger helper or meat extenders to take your one little data set and kind of fluff it up so it looks like it might be meaningful. And this is a common problem in journal articles where either the peer reviewers are not careful or the journal is just looking for more material on a particular theme. Obviously, we don't want falsification, fabrication of data, or plagiarism. That's misconduct. But when we think about research methods and research quality, typically what we are looking for is good, happy data that says something, as opposed to what most of us get when we do research, which is a null result, or even a negative, unhappy, it didn't work anything like what I thought it was going to do. Many people, including the International Committee of Medical Journal Editors, say we need to be publishing those negative results. Now, their journals promise to follow the guidelines. Whether they publish negative results is another question. Often they don't, because it's a waste of money if you don't put out there the fact that people shouldn't go this particular path. But people are looking for happy results that are translatable, that are turn-inable to something that can be funded or in some future way useful. The question of who, not just what gets published, but who can publish, is the area where, as I said before, is probably more contentious than any other area of research ethics, whether it's federally funded or not federally funded. And the International Committee started talking about this in the 1990s as an area where they had, back then it was requirements, very strong feeling about what needed to be the criteria for being an author. And others have jumped on that bandwagon, so that the standards are increasingly formal and increasingly stringent, and journals are increasingly requiring people to actually sign a document saying, I did this and this and this and this, before they get to be counted as authors. One of the things that everybody agrees on is that you don't get to be an author unless you have made a significant or a substantial intellectual contribution to the article. But across disciplines, what significant or substantial means can be really different. So you may end up with geneticists where everybody has their one little piece and you have 140 authors on a paper in alphabetical order, each one having contributed their little significant piece without which the paper would not be doable. Similarly in physics, you can end up with huge numbers of people in physics because their norm is that substantive or significant contribution is something fairly small. When we think about what it means to be an author, though, it's not just about credit. Increasingly, the standard is taking responsibility for your work and for the quality of the article itself. And that's where I'd like to spend the rest of my time. What does it mean to take responsibility for the work in a paper? This is where, in August of last year, the ICMJE changed their standards. In 1990 through 2010, 2009 is when they began to review and revise it, ICMJE had 3 criteria. You needed to have substantial contributions to the conception and design or analysis and interpretation of data, and, very important capital letters and in the policy, drafting the article or revising it critically for important intellectual content, i.e. writing, and then third, taking final approval, giving final approval to the version of the manuscript that's going to be published. So you say, yes, I've seen that and I agree with it. Now for 20 years, that stood as a fairly strong statement of responsibility. And I had a number of faculty colleagues, I had a lot of students who say, we can't do all those things. Not on the papers we write. I can't actually do all of the manuscript, especially not if we're going to have all the people who were involved in the research on the paper. This has been an interesting point of debate, and I will suggest that you take a look at the authorship discussion in the current version of the International Committee's article, because it does address multiple things I'm going to go through in a little less detail than they do. But the question of how you can have a multidisciplinary team and have everybody final approval of the paper. How do I know what you were doing in your lab? How do I know how you analyzed the data that you contributed to the paper? How do I know that you didn't somehow slip something else in? And this question of what it means to take responsibility and provide final approval for the paper is one that took a lot of debate. So for several years, the International Committee was back and forth about what this means. This is what caused them in part to revise the guidelines. And they came up with new criteria that say substantial contributions to conception or design. You don't have to have thought about it and designed it. You can do one or the other. And they added acquisition of data. I think this was in part for clinical purposes, because clearly someone who has generated the data has done work, or that work has to be well done. Then analysis and interpretation of the data. You had to have done something with the science, with the data that is generated or the way in which the data are generated to start with. Then you had to have been involved in the writing, and this didn't actually change the language, drafting the article or revising it critically for important intellectual content, and final approval of the article, not changed, and a paragraph that is much longer that we're going to look at in a minute. Agreement to be accountable for all aspects of the work. In addition to the parts that he or she has done alone, an author should be able to identify which authors are responsible for the other parts. You need to be able to be accountable for the work as a whole. The rest of the paragraph, agreement to be accountable for all aspects of the work in ensuring that questions related to the accuracy or integrity of any part of the work are appropriately investigated. So, do you have a question? How do you know that your author colleague didn't do something in the lab that he or she wasn't supposed to? How do you know that your colleague didn't enroll patients that shouldn't have been enrolled as participants? You ask. You investigate. You query. So that all aspects of the work, we know about the accuracy or integrity, and any question is resolved. Resolving the question being the responsibility of the one asking. In addition to being accountable for the parts of the work he or she has done, an author should be able to identify which co-authors are responsible for which specific other parts of the work. And, in addition, authors should have confidence in the integrity of the contributions of their co-authors. So going back to that question I asked at the beginning, you're on a paper with people you don't know why they're there. You may not be able to meet that last standard, that you don't know about the integrity of the contributions of your co-authors because you don't know what their contributions were. Which takes us back up to the first paragraph of appropriate investigation and resolution of your professional concerns. This is a much clearer statement of a peer review-based, community-based responsibility for the quality of the work of the article as a whole. Now, accountability is a funny word. We see it in a lot of different places these days. And there isn't with the exception of a couple of biostatistics friends and me, there isn't a lot written on the notion of accountability in ethics, let alone in the ethics of research. But when we talk about what it means to be accountable, we're talking about being able to give a reasoned, well-grounded account of what has happened. Taking responsibility, yes, but more particularly being able to track out what happened and why. So an obligation or willingness to accept responsibility or to account for one's actions. What did you do? Why did you do it? And accountability in this regard becomes a really strong statement of the need to be able to talk with other people, to know what they did and how they did it and why they did it, and to resolve any questions that you may have about the quality. So under this new standard, and I don't know that it's a new standard, it's just a new statement of what many of us would have hoped would have been resolved by the previous three requirements, authors have both an individual and a collective responsibility for the quality of the work, for the data, for the analysis, even if they didn't collect the data, even if they didn't do the analysis, and for the conclusions of things that are published under their names. And the way in which the ICMJE talks about it, people should be able to take public responsibility for their work and have full confidence in the accuracy and integrity of the work of other group authors. So you don't have to have done the work, you don't have to have understood necessarily the fine points of the work, but you need to be able to know that you trust the person who did the work that was out of your hands when it was done. This again is a definition of collaboration, what it means to work well together. Not necessarily just exchanging emails with data, but really engaging on a scientific question. So in a big interdisciplinary group, we may have lots of co-authors, and we may have lots of co-authors whose specific contributions are defined differently by them as opposed to how others say that, that they may have worked. The argument here is that your contributions need to be assessed by the group. The order of authorship, which in almost every field indicates the importance of the contributions, needs to be worked out by the group. People need to know what everybody did and how important it was to the paper. This is the ideal world, not necessarily the politically charged world in which only the first author and the last author count. That's kind of how it is in my institution. Maybe if you're number 2, it's okay. If you're number 5, what were you doing? But the idea that a group may be 40 people and every single one of those 40 people is important, we need to be able to decide up front who's going to be in what order. And then with a large multi-center study that has lots and lots of institutions and lots of groups and one key person from each institution, that may be a group that gets a name, the support study or the West Virginia group. And then a box with the names of the people who were part of the group and identified named key authors who will take responsibility and provide accountability for the quality of the paper. What ICMJE has said since 1990 is everyone who qualifies for authorship should be a named author, and everyone who is a named author should meet the criteria for authorship. And that seems pretty straightforward. It's just a lot harder to engage in practice what these standards really mean in a political as well as a practical sense. They also, since 1990, make it very clear, something that upsets a lot of people in my institution, that general supervision of the study group, providing lab space, providing grant money to support the postdoc who did the work, does not qualify for authorship unless it accompanies those other criteria. That person who did those things, or those people who did those things, should be acknowledged, placed in the acknowledgments, and the contribution that they made to the research that didn't qualify for authorship should be identified in the acknowledgments where they are properly thanked with their permission. Because if you acknowledge somebody, let's say I would like to acknowledge the head of the World Health Organization for information I received on my paper. The World Health Organization head doesn't know he had anything to do with my paper because I just read his newsletter. Before I acknowledge him, I need to get his permission. Because it may seem to many readers that someone who is thanked and acknowledged actually likes what's in the material that's in publication. And so some journals even require signature authorization from someone who's been acknowledged, not just the author saying, yes, we asked. Named authors have additional responsibilities on top of the ones that we've already heard about, and these have been in the guidance for a long time. You need to be able to certify that you followed all the other rules regarding research, particularly human subjects and animal subjects, review procedures within the institution. You absolutely need to disclose conflict of interest, both financial and often other kinds for some journals. Interpersonal conflicts of interest, questions of whether you might have other papers out on the topic. You need to make the study data available by registering any clinical trial and by providing the paper, if it was funded by federal grant, available through the National Library of Medicine afterwards. You need to respect the moratorium that the journal is likely to put on you talking about the data. So with fast publication online, things comes out a lot quicker. But if you call a press conference to talk about the paper that's coming out in New England Journal of Medicine and the press conference is the day before, your paper may not actually get published in New England Journal of Medicine, or you'll never publish there again, because they want to have the privilege of announcing the paper that is now their paper because you signed over copyright. Moratoria are not taken as seriously, I think, by those of us who don't publish big splashy stuff. But it's big news when a big paper gets published, and the journals want to be the ones to break the news. And then increasingly, and any of you who are in infectious disease research, the question of whether your research data or methods might be used for harm. Can what you've published be used in a way to build a biological weapon, to be used to deliver a disease in a way that would be harmful to others? This is an issue where Homeland Security has a lot of interest. FBI has a lot of interest. Editors have a lot of interest too, because they don't want to visit from Homeland Security any more than any of us do. So in a big interdisciplinary group, we may have lots of co-authors, and we may have lots of co-authors whose specific contributions are defined differently by them as opposed to how others say that, that they may have worked. The argument here is that your contributions need to be assessed by the group. The order of authorship, which in almost every field indicates the importance of the contributions, needs to be worked out by the group. People need to know what everybody did and how important it was to the paper. This is the ideal world, not necessarily the politically charged world in which only the first author and the last author count. That's kind of how it is in my institution. Maybe if you're number 2, it's okay. If you're number 5, what were you doing? But the idea that a group may be 40 people and every single one of those 40 people is important, we need to be able to decide up front who's going to be in what order. And then with a large multi-center study that has lots and lots of institutions and lots of groups and one key person from each institution, that may be a group that gets a name, the support study or the West Virginia group. And then a box with the names of the people who were part of the group and identified named key authors who will take responsibility and provide accountability for the quality of the paper. What ICMJE has said since 1990 is everyone who qualifies for authorship should be a named author, and everyone who is a named author should meet the criteria for authorship. And that seems pretty straightforward. It's just a lot harder to engage in practice what these standards really mean in a political as well as a practical sense. They also, since 1990, make it very clear, something that upsets a lot of people in my institution, that general supervision of the study group, providing lab space, providing grant money to support the postdoc who did the work, does not qualify for authorship. unless it accompanies those other criteria. That person who did those things, or those people who did those things, should be acknowledged, placed in the acknowledgments, and the contribution that they made to the research that didn't qualify for authorship should be identified in the acknowledgments where they are properly thanked with their permission. Because if you acknowledge somebody, let's say I would like to acknowledge the head of the World Health Organization for information I received on my paper. The World Health Organization head doesn't know he had anything to do with my paper because I just read his newsletter. Before I acknowledge him, I need to get his permission. Because it may seem to many readers that someone who is thanked and acknowledged actually likes what's in the material that's in publication. And so some journals even require signature authorization from someone who's been acknowledged, not just the author saying, yes, we asked. Named authors have additional responsibilities on top of the ones that we've already heard about, and these have been in the guidance for a long time. You need to be able to certify that you followed all the other rules regarding research, particularly human subjects and animal subjects review procedures within the institution. You absolutely need to disclose conflict of interest, both financial and often other kinds for some journals. Interpersonal conflicts of interest, questions of whether you might have other papers out on the topic. You need to make the study data available by registering any clinical trial and by providing the paper, if it was funded by federal grant, available through the National Library of Medicine afterwards. You need to respect the moratorium that the journal is likely to put on you talking about the data. So with fast publication online, things comes out a lot quicker. But if you call a press conference to talk about the paper that's coming out in New England Journal of Medicine, and the press conference is the day before, your paper may not actually get published in New England Journal of Medicine, or you'll never publish there again, because they want to have the privilege of announcing the paper that is now their paper because you signed over copyright. Moratoria are not taken as seriously, I think, by those of us who don't publish big splashy stuff. But it's big news when a big paper gets published, and the journals want to be the ones to break the news. And then increasingly, and any of you who are in infectious disease research, the question of whether your research data or methods might be used for harm. Can what you've published be used in a way to build a biological weapon, to be used to deliver a disease in a way that would be harmful to others? This is an issue where Homeland Security has a lot of interest. FBI has a lot of interest. Editors have a lot of interest too, because they don't want to visit from Homeland Security any more than any of us do. I looked and I didn't see a West Virginia University publishing policy. Many universities have publishing policies which list the standard practices within the institution, and it's usually the medical school that has it, for how we think about authorship, how we think about who should be an author, how they should be an author. A number of very high-level universities do have them. Almost every single one came out of a conflict, a scandal where somebody said I should have been an author, and the big person who became an author who really didn't do anything. And the question becomes, for the university, we need to make it clear what we accept and what we don't accept. And this kind of policy statement can be really helpful in an academic institution where junior people might think they're on a fast track to a publication and find suddenly that they're not, or find that they're fourth author when they thought they were going to be first. So if there is a project that, if someone is looking for a project, this is the area where it could be very useful, even if you don't get a policy statement, to get people talking about what the different standards in their fields might be and what kinds of research they would like to see written in what sorts of ways. So when we think about accountability, it's not just the author. And this is one of the things that both ICMJE and COPE have really begun to focus on. Being able to give an account of how the work gets published and what happened to get the paper written in the first place is a responsibility of multiple people. The publication's named authors, the author's institutions who fundamentally own the data that's being published, peer reviewers who either agree that the author that the data need to be published in the form they are, or that it needs to be revised in a particular way, and then the journal in which the data are published. That's a pretty crowded field that looks very much like what we talk about when we say scientific community. And I've gotten, no, I haven't. Sorry, I think I had another slide in there, maybe it's later. When we're talking about accountability at that level, especially with regard to journals then, we are thinking in large part about the final product. What is put out as the final product? And accountability for journals often becomes a question of knowledge that becomes available after the fact. Version control is what the ICMJE calls it. What do you do when you discover an error in the publication, and how do you deal with it? And then more importantly, perhaps, what happens if that error turns out actually to be misconduct and not at all an error? Corrections are needed for errors of fact, and ICMJE recognizes that errors are a part of science as well as a part of publication. And what we need to do when we find an error is investigate it, find the truth, and publish the truth. When there's a question that's not clearly an error, they want to see letters to the editor. That is an area where if you have a different interpretation of the data, write in, tell us about it. But when scientific misconduct is alleged, or when there is a question of the legitimacy not just of perhaps an error, but the process by which the data were determined and developed, there they want to see much more careful concern and appropriate investigative procedures at the institutional level and at the editorial level. And to think about ways in which that sort of investigation should take place, they say that there is no single system that we can always say is going to work. Each case is going to be just enough different that it needs to be handled on an individual basis with all of the relevant stakeholders. Now, I'm not sure who a stakeholder might be here. In some cases with a clinical trial, if there's misconduct alleged, the clinical trial stakeholders might include the participants in the research. They might have something to say. And where you'd involve them in the process is a big question. But these guidelines are for the editors. Editors are encouraged to talk to the institution and to seek to find out what's happened with an investigation of misconduct. To be proactive in ensuring that their journal doesn't continue to have misguiding or absolutely falsified information published in its pages. If the investigation proves scientific misconduct, they say a retraction needs to be provided. A retraction that, for the journal, is about maintaining its accountability. Retraction statements, in order to be accountable, need to include why things were published wrongly and why they're being taken back. Explaining the situation that got the wrongful stuff into print in the first place. And even if no misconduct is proven, it may still be necessary to have an expression of concern, which is the phrase used for that letter of accountability, saying, well, we looked at this, we thought there was a problem, we followed it up, we didn't find any real wrongdoing, but we're still not really happy about this thing. And we just want you to know. So that your research doesn't try to base future work on something that may in fact not be what it looks like. The Committee on Publication Ethics actually has a series of recommendations for how journals and institutions should work together when they are dealing with a problem of suspected misconduct or any kind of questionable data that have been been published. Now, recognizing COPE is mostly in England, and their system of both law and society is a little bit different from the United States. But they are very quick to say, and they say it in a couple of places, institutions are responsible for the conduct of their investigators. So the institution cannot step away and say, he did it, it's his fault, now we're just going to fire him. Because they are responsible for the behavior of the investigator and for the environment in which the investigator did the misconduct and in which the misconduct is followed up on. Journals are responsible for the conduct of their editors, obviously for safeguarding the quality of the research. And they say, as a result, it's important for these two groups to get together and talk to each other about the thing that the other doesn't know. I know this about what we did with the publication. I know this about how this person talked with us. You know about what was going on in the institutional environment. Let's share that information to have a whole picture. There are a number of things that they recommend institutions have, one of which is the point person that journal editors can talk to if they have a question. But they say that the university has an obligation, if they have a question about a publication by a researcher, they need to talk to the editors. That the institution has an obligation to inform the editor. And that there is an institutional obligation to begin inquiries that would include, perhaps, what the editor knows about the way in which the publication's work was done and how ultimately the publication of the data came to pass. Journals, and the two in yellow are the two that are most important for me, have an obligation to inform institutions if they suspect misconduct. So editors need to go back to that key person at the institution and be able to say, you know, we've had some questions raised about this paper. We'd like to talk to you about it. We think perhaps you ought to investigate. And the journal needs to be prepared to issue a retraction or to publish a letter expressing concern about the quality of the paper, particularly when they have the findings of misconduct. I want to end with something that is almost impossible to see from where you are, and I apologize, but it is COPE's decision tree for how a journal editor should respond when there is a suspected act of misconduct or a paper published with data that are suspected to be false. And it starts with a reader expressing suspicion of fabricated data, and it goes down to contact the author. The author replies or the author doesn't reply. Here, when the author doesn't reply, we go on to this arm of the tree. Here, when the author replies and gives a satisfactory explanation and apologizes, that's the end of the story. Apologize, retract, everybody's okay. Apologize with an S because we're in England. Unsatisfactory answer or admits guilt, we go down another path that also ends in retraction and accountability for the quality of the work and public acknowledgement that the data are not reliable. On the other side, the other arm here, where there is no response, the responsibility goes back to the institution, and the institution to act particularly in a way that accounts for what happened that resulted in the publication having data that looks suspicious. And perhaps it just looks suspicious because there's not an adequate explanation of the process. But then an addition or a correction can be added and the research record becomes reliable again. COPE's flowchart adds an additional person, and this is where I would like to end with a challenge back to you. We've added an additional person to this sense of communal accountability, and that is the reader. The reader of scientific publications in COPE's, not articulated, but certainly in their flowchart, the reader of scientific publications is where accountability also starts from the other side. What are you reading? What are you seeing? What do you need to give back to the scientific record? We start with the reader. The International Committee notes that real peer review starts when the article is published. Instead of 3 peer reviewers and their comments, you may get, if you're lucky, a couple hundred, couple thousand. The leading article in many journals will, at least people will read the abstract, if not the whole article. And if somebody there sees something that makes them worry, what is their responsibility? ICMJE says that we have letters to the editor for that purpose. We need to be thinking clearly about ways for people to communicate back to the journals to be able to talk about the scientific exchange of ideas that the journal may have stimulated, that the article may have stimulated. So not necessarily for discussion now, in part because we've got only about 5 minutes, but how might reader accountability work? First off, how many articles do you get to read in their entirety every week? Maybe we should measure it by month, because not all of us get to read every week. How would we define that reader accountability? And at what level? And then what would it look like if we could take letters to the editor out of that last section of our CVs and move it up where it's a little bit higher in esteem? That you're actually engaging in some sort of accountable discourse with peers. I think it might be an interesting world to live in where obviously we wouldn't publish as much, but we might have a little bit more exchange. Not publishing rebuttals in new science, but rather talking about the science that's there. We might have more reproducibility in our research. We might have more collegiality in our research environments. And that is what I have to say. So thank you very much for being here. We've got a couple of minutes for questions, I think. Is there a new class coming in at 1 o'clock? Medical students chomping at the bit to get new knowledge. Okay. I'm here. So thank you all very much.